Measles cases have surged to their second highest level in nearly 2 decades, and there are cases in California. Dr. Richard Chaffoo is here to explain more. Dr. Chaffoo, good morning. Thank you for being here. My daughter had a fever for 3 days, finally ended up in urgent care on Sunday, and the doctor there mentioned the measles. Yes. And I stopped and I said, the measles?
Right. We don't think about that, Shally, because of course, as parents, we immunize our children, but it's important, as you mentioned early on, that, you know, there are more cases in the first 3 months of this year, measles in the United States, than there were in the entire previous 12 months. So it's become a very serious health risk.
Is something changed that we're talking about these now? Because I feel like we haven't talked about the measles in a while.
We may not have. And the thing that's changed the most is people are not having their kids vaccinated. You know, something we've talked about on the show many times before. And of course, with vaccination, it's 97% effective. If you don't get the vaccinations, though, unfortunately, you put not only your children at risk, but other people around you at risk. And this is what's happening with our sudden surge in these cases that we've seen.
I hear measles and I already think dangerous. Is it really dangerous?
It can be. You know, it's a virus, and certainly a lot of the symptoms are upper respiratory, but it can cause infections in the middle ear, otitis media, laryngitis, bronchitis. It can actually cause swelling around the brain called encephalitis, which can be fatal. You can get a lot of brain swelling in a very young child. There's nowhere for that brain to go because it's up against the bony cavity. So it can be a very serious problem. Also in women that are pregnant, if you develop measles during pregnancies, there's a higher risk of maternal death, low birth weight, premature delivery. So very serious complications can happen.
And how is measles passed from person to person?
It's all respiratory. So it's highly contagious all through the droplets. So when we're around other people, it's very easy to get. We can get it from contact surfaces as well, touching something where the virus is sitting, because it can remain dormant for quite a long time.
Some of these symptoms that I want to talk about, Dr. Chaffoo, I know we've been sick in our house for like almost 6 weeks. It's just traveling, and when I post that, I have a lot of other families like messaging saying, Shally, it's been weeks and our family's just been down. I look at this and a lot of these symptoms, like everybody has as we're finishing up the season.
You're right, because you know the measles is a virus, and so most of what we're going to see anywhere are viruses, you know, rhinoviruses and other viruses. So really, how do we tell the difference? It's really the severity of the symptoms, Shally. So if you're running a really high fever,
like
if you're not getting the 103, 104 degrees, measles is associated with redness around the eye called conjunctivitis, and then development of a rash. And the rash usually occurs about 10 to 14 days after you've been exposed to the virus. You get the rash, and the rash lasts anywhere from 5 to 7 days. So, but you're highly contagious within several days prior to the rash and then after you've developed the rash.
Is it like a red itchy rash?
It's a small red bump, and usually it begins on the face and extends and it spreads down through the trunk.
If you have a child and you may be experiencing any of these symptoms, what do you do when you go to the doctor?
The most important thing is to call your physician's office, get in to see your doctor, have them examine you. Again, if you haven't had immunizations, you have a higher risk of developing that as an infection.
Good information. It's always good to talk about these things. Dr. Chaffoo, thank you for being here.
Thank you, Shally.
All right.